I'd like to call on Dr. Kishor. Again, as Dr. Mohan Isaac said, has been the spirit and passion behind this. And to be a teacher, you need to be passionate in addition to the other competencies. Dr. Kishor is Associate Professor of Psychiatry at JSSMC, Mysuru, and he'll be talking about utilizing the principles of adult learning. Dr. Kishor, over to you now.
Yes, ma'am. Thank you so much for the wonderful introduction. It's a privilege to discuss about our passion in teaching. I would like to talk on utilizing the principles of adult learning and SLOs for teaching psychiatry pages. At the end of this session, I think we will be able to appreciate the difference between adult learning and child learning. We would like to discuss on what is the difference between undergraduate and the postgraduate learning. Then I will touch upon what is this specific learning objective, and then we will discuss briefly about what are the domains of learning, what is the appropriate examples. I'll keep my slides as simple as possible so that everybody is able to comprehend what we are talking about. Now, what we want to emphasize is that in every interaction with the postgraduates, teachers have to remember that they are interacting with the adults. This is something we have to think about every time because most of the time we assume that we are dealing with them as children's. Now, what does this adult learning encompass? Now, adult learning means that the adults learn only when they want to. That is, that they control learning. It's different from what we see in children's. And adults have higher motivation, they require higher motivation to learn. They would like to see what do they gain from this learning. Will it help in the practice? Will it help me as an individual? And very important is that they are very resistant to change. They have set ideas. It requires a lot of time and effort for them to make a change. And they are pragmatic in learning. That means they are almost very realistic about how the things will be used in their everyday process of interacting with the patients. Many times we assume that the first year postgraduates are different from what they have seen in the subsequent years. Adult learners are very diverse. Each adult learner seems to have a unique character in their ways to assess information, process that, and utilize it. Most of them, they draw experience from the past. And usually in adults, learning is self-initiated and it is associated with immediate goal. Sometimes it will be easy for us to understand when they say, I just want to ensure that I pass these exams. So this makes a lot of sense for them when we talk about how our learning is going to make them relevant. Next is that we need to understand how is that adult learning in terms of undergraduate and postgraduate learning are different. Since most of us teach in medical colleges, we will be simultaneously dealing with undergraduates and postgraduates. Now the question is that should we use the same logic of teaching undergraduates and postgraduate? The answer is no. In the undergraduates, most of the learner is dependent on the instructor for all or most of the learning. Whereas in post-graduation, it is a self-directed learning. In undergraduate, the teacher or instructor usually takes the full responsibility for what is taught, how it is learned. Whereas in the postgraduate learning, the learner is responsible for his own learning. As well, he does his own self-evaluation, which is characteristic of the postgraduate. In the undergraduate, the teacher or the instructor evaluates what is being learned. Whereas in the postgraduate, they themselves do the evaluation and they always look at how real is the learning when they are interacting with a different set of patients. The contents and the units in the undergraduates are logically connected all through, from anatomy to medicine. Even though we are talking about horizontal and vertical integration, it is a very systematic approach in undergraduation. Whereas in post-graduation, they turn to learn A to Z in one patient. They might start with fish psychopathology, but simultaneously they might be learning management of treatment-resistant depression. So they seem to work with the situation, how the patients present, and they can learn from A to Z and synchronize different ways of learning. Now, the question we have to answer is, what is this specific learning objective? Can we design it? And where can we use SLOs? At the start of my presentation, I have narrated that exactly at the end of this presentation, what is that we are going to learn. So in every interaction with the postgraduates, whether it is journal club, bedside clinics, or in the seminar or case conference, we can have specific learning objectives at the end of this. This is what we expect the postgraduate to do. Specific learning objectives in the United Kingdom are also called as ILOs. They are called as ILOs in terms of intended learning objectives. Now, the Medical Council of India has spoken about competency-based curriculum. I hope everybody is able to log in and see the competency-based curriculum is not just for undergraduate, it is for psychiatry postgraduates as well. And they have used the word cognitive, affective, psychomotor domains as learning. And many of the psychiatrists believe that it is only restricted to a branch of psychiatry. Now, the answer is no. The cognitive, affective, psychomotor components are for every branches of medicine, not just for psychiatry. Cognitive means that in the knowledge domain, that the student has adequate knowledge. Affective means how good is his communication, verbal, non-verbal. And psychomotor means physical skills. So this is important for a teacher to know, so that when he is trying to incorporate in the teaching learning, the teacher has to know which domain is involved and how to fine-tune the learning for that particular domain. I'll give simple examples. For example, in the bedside clinic and you are trying to talk about cognitive domain, you can say, elicit the clinical criteria for depression. Here, the clinical criteria means that the student should know exactly the criteria for depression. That means he should have prior knowledge of that. This is the very good example for cognitive domain. It is important that we encourage the postgraduates to see and learn from each domain so that there is clarity of learning in each aspect. Now, what is the best example or a good example for affective domain? In bedside clinics, if you ask the postgraduate to establish rapport with the patient and explain the need for admission, here the cognitive domain of whether the criteria are met or not met are not important. Here we are looking how good is the student looking at the communication skills involving the patient and trying to develop his communication skills of establishing rapport, explaining him the need for admission, seeing how he is able to understand the patient's perspective, communicate the need for admission. This is a good example for affective domain. So we need to help the postgraduates continuously look at what chunk of learning needs to be fine-tuned. If the teacher is very good in understanding the domain, he can see that that particular student who seem to have problems in particular domain or he requires fine-tuning of that domain can help. Then what is psychomotor domain? I'll give examples in bedside clinic because we believe that most of the learning will happen with the patients. Now in psychomotor domain, the postgraduate gets an opportunity to demonstrate his skill. For example, assess for postural hypotension. That means the postgraduate will go check his PP in the supine position as well as in the standing position and see the difference. Then if we want to see how the postgraduate is able to learn or demonstrate physical restraint in a role play, we need to ask him demonstrate the method. We should not put it in cognitive domain. Can you tell me how do you do it? It's better you ask the student to demonstrate that skill, because the skill here require a demonstration of that particular learned behavior of handling the agitated patient. So these are the three different domains, and entire branch of medicine has now been categorized into these segments so that there is a lot of clarity among the students and the teachers to know which domain and which segment is required and how that subject can be taught in those domains. So I would like to conclude that a good postgraduate teacher will try to generate curiosity. He presents very clear and logical sequence of learning, utilize teaching learning which is meaningful, and covers the subject adequately, and in all through his teaching learning shows enthusiasm